Restrictions on travel and the closing of non-essential businesses. We will take a look at efforts around the world to stop the spread of the coronavirus. Hello, I'm Anand Naidu, and this is The Heat. The European Union is proposing a ban on non-essential travel for 30 days. In many cities on the continent, streets are empty, countries are enforcing a lockdown, and in many places people are keeping their distance from each other, even while lining up to buy groceries. Here in the United States, President Donald Trump announced new guidelines telling Americans to avoid gatherings in groups of more than 10 people and to stay away from bars and restaurants. CGTN's Nathan King has more from the White House.
After weeks of optimism from the US president, despite mounting evidence to the contrary on the coronavirus, a dose of reality, a reality check indeed from the podium at the briefing room here. Essentially, Donald Trump saying, stay home if you can for the next 15 days. They are not ordering it, but they are new guidelines. Also saying this, that the crisis, he thinks, not necessarily the actual infections, but the entire coronavirus crisis could last until July or August. This is a new reality check from the entire White House. Also, US President admitting, you know, he cheerleads the stock market. Well, we saw what happened. Well, he says he thinks there may well be a recession. They are considering also curbs on domestic travel, although he does say he's going to support the airline industry 100%, but rules out for now a sort of national quarantine. But it was a very sober US president. Also a plea to millennials from other members of the coronavirus task force. There were scenes all over the country on Saturday night of people going out for St. Patrick's Day, packed bars. This shocked a lot of governors into action in New York, in Massachusetts, elsewhere in California. And they really sort of led the way on basically ordering people to stay home. The federal government has followed up. The coronavirus task force saying, please, millennials, anyone born 1980 onwards, please keep your parties down to 10 people or just stay at home because you can infect older, more vulnerable people. So a real call to arms here, and it's obviously an admission that they know what's coming. Having seen other countries thinking the US may have dodged a bullet, this is not the case. The number of cases are multiplying, test kits are still very scarce, and the fear is that without social distancing brought in on a big scale like we've seen in other countries, the US will not be able to cope with this crisis. So it's not just about the coming days, of course, it's the next weeks and months, a real test for the USA, federal government, state government, and of course this president here. Nathan King, CGTN at the White House.
Well, to discuss the current efforts to contain the virus, we have in our studio Shweta Chakraborty. She is a risk and behavioral scientist. Joining us via Skype here in Washington, D.C., Pepe Zhang is an associate director for the Latin America Center at the Atlantic Council. From Rio de Janeiro, Paula Regis is a resident doctor on infectious diseases at the Osvaldo Cruz Foundation, a leading research institution in Latin America. And the journalist and author Maria Paula Carvalho joins us from Paris via Skype. Welcome to all of you. Shweta, let me start with you here in the studio. The White House held its daily, well, what has now become a daily briefing on Monday afternoon, and we just reported on some of those measures that have been taken. The president urging people to avoid gatherings of more than 10. In fact, over the weekend it was 50, so now it's down to 10. Canada has closed its borders. A lot of states closing schools, and restaurants are being urged to close as well. In fact, New York has restaurants are only doing takeout business, no people coming in. Where are we now?
Right, so the virus emerged and it spread across the globe. It's now called a pandemic. We expect to see the transmission and the mortality fluctuate across different regions. That's what's happening. And then based on that, reactively, because we didn't, especially in the United States, have the proactive measures and preventativeness that we needed in place to really deal with an outbreak of this type, despite all of the data we've had from the past, the swine flu, and before that, Ebola, and so many others, we are now responding. And so a lot of this is perceptions from the public that the government is responding to, demand for zero risk and exposure to risk. And a lot of it is really just to deal with the human behavior, because mandates voluntary mandates don't always work. As we're seeing in other parts of the world and in the United States, people will continue business as usual. And for the government, it's a fine balance between the secondary impacts to the economy and the primary impacts on public health. So what we're seeing is now sort of a disjointed effort across the United States, but from the federal government, clear indication of what is expected at the voluntary level. And ultimately, I think we're going to start seeing more federal mandates if people don't comply.
Right. So would it be fair to say, Shweta, that we are seeing, I guess, one response, which is the social response, another response, which is the medical response, and we even have a third response, which is, of course, the economic response that we're seeing. Insofar as the social response is concerned, is that working?
Yeah, and that's exactly right. We are thinking about all of the different impacts to the economy, society, and public health, and we can't look at these in silos. We have to look at how they all interact with one another. The social response, asking people to voluntarily no longer go out and to have these smaller gatherings.
Right.
If the CFR, if the fatality rate is not high enough to scare people, we're not going to see true effective social distancing. And that's part of the issue that's going on here. That's part of what happened during swine flu, is that even taking kids out of schools, keeping them at home, doesn't mean that they are really truly being socially distanced. So overall, is it really going to be effective? It's critical that we are aligning our not just voluntary efforts, but actual evidence-based policies to the reality of the risk, and that's what we need to clarify.
And very quickly on the medical response, we did hear during today's, I don't think we heard at the news conference, but in news today, that the testing for a vaccine will start soon.
Yes, that's correct. But again, vaccine rollout will take time because we need to test for tolerance, efficacy, and safety. And there's no way any sort of class of drug, including a vaccine, can roll out without knowing for sure that it won't cause more harm to the public than it will good. So it's really imperative that even with it being fast-tracked, it goes through the appropriate trial phases, and so that's what we're seeing.
All right, let me go to Paris, to Maria Paula. Maria Paula, Europe is now being described as the new epicenter of this viral outbreak. Many countries are imposing restrictions. What can you tell us about the situation there, and especially in France, where you are right now?
Continues to spread in Europe and is accelerated. Here in France, where I am now, we have 6,600 people infected, 148 died, and while we are talking here, there are 400 people in hospitals with serious threatening life conditions. President Emmanuel Macron said this is the biggest public health crisis in a century. He addressed the nation tonight after a meeting with his ministers and advisors. Macron announced more restrictions, a sort of a total lockdown in France, as we have already seen in other countries, such as Italy and Spain, where people have been forbidden to leave their homes unless it's for essential tasks. So, in other words, one is just allowed to leave home to go to the doctor or to buy food. The idea here in France is to slow down the epidemic and avoid situation where hospitals would be overwhelmed by a number of serious cases. The army will start to help to take sick people to emergency services. Taxis and hotels also may be used for fighting the epidemic. And as Macron said, we are in a war, not in a war against another country, but against an invisible enemy. Remember that yesterday we had elections here in France, 35,000 municipalities choosing their mayors. But now the second round of French municipal elections, due to next Sunday, the 22nd, is suspended. Macron decided before that it was important for democracy that the elections were held. But now he decided that it's not a good idea to continue with this electoral process, even though a lot of sanitary measures had been taken yesterday. Since yesterday, it's important to say also all the nurseries, schools,
Right.
high schools are closed, and they will remain like this until the Easter holiday, which will start in April 11.
Okay. Paolo Regis, you are part of the WHO COVID work group. When we look at the international response to this, what are the WHO's main concerns right now?
So in February, actually, I had a chance to join the forum on research and developing technologies, and mainly like development and research that happened there in Geneva. And after there, all the groups were divided into understanding all the complexity of this epidemic and now pandemic situation. And the most important thing actually was to raise what were the knowledge gaps that we have, because it's important, it's a new pathogen, so we need to understand and we need to say that we don't know that much about this pathogen, and that's why it's so important to invest in research and know the relevant data that may change the course of this pandemic. So basically, as said today by Dr. Tedros in his daily briefing, and as we know, it's super important, these daily briefings, because they raise the awareness around the disease, and it's also a way of WHO showing how important and how all of us, including countries and including us, society, we need to act in favor of containing this epidemic, this pandemic. So right now, WHO has said they believe that the most important thing is a combination between understanding the importance of tests and making mass tests to the population, and also understanding the process of mitigation of it, which will include, as said before, all these countermeasures, these non-pharmacological measures that involve our availability to stay at home and to avoid the spread of the virus and flatten the curve. Right now, all the countries actually should be worried on flattening the curve. Even if they still don't have dissemination around the country, around the cities, they need to be worried of what is coming ahead. And what is coming ahead is the virus. The virus is a pathogen that we cannot see, but that will impact a lot on the health system. It's not that much virulent in a scientific way, but it's virulent for health systems. And as I said, it should not be that much virulent to human solidarity. We need to act on performing all of these combinations, which demands political issues, scientific issues, economical issues,
Right.
but mainly also work for our side, for our society side.
Pepe Zhang, you spend a good part of your working life focusing on Latin America. The coronavirus has now spread to Latin America. There are about 200 cases in Brazil right now. We did get this report from our correspondent there, Paulo Cabral, and this is what Paulo had to say. Let's watch.
Many schools and universities have cancelled classes this week, and a growing number of companies are instructing their employees to work from home. Over the weekend, some football matches have been played without fans in an effort to avoid the spread of the virus. Here in the state of São Paulo, which has more than half the total of confirmed cases in the country, the government has, among other measures, announced the prohibition of gatherings with more than 500 people, and even more restrictive measures are expected to be announced this week. However, on Sunday, many people took to the streets in demonstrations against the Brazilian Congress and in support of President Jair Bolsonaro. Over the weekend, Bolsonaro himself had advised people not to attend the demonstrations, but on Sunday he ended up joining the gatherings on the streets and grabbed cell phones to take pictures with the people, against recommendations of Brazil's Ministry of Health, which has been telling people to avoid crowds. Jair Bolsonaro recently traveled to the United States with at least one aide who was diagnosed with the coronavirus. The president himself was tested, but results came back negative. However, Jair Bolsonaro is expected to be tested again to rule out any possibility that he has the virus. Paulo Cabral, CGTN, São Paulo.
So, Pepe, what can we expect in Latin America right now?
Thank you. I think the silver lining
for Go ahead, Pepe.
Yes, the silver lining here for Latin America is that, as you mentioned, the virus had broken out previously in China, Italy, and other parts of Europe. So the world kind of bought Latin America a little bit of time to think about what are some of the things that do work and what are some of the things that do not work. And this year, economically speaking, was meant to be a year of economic recovery for the region. Last year, the region of all the regions of the world had the slowest growth rate. But this economic picture is becoming much more complicated because of the downward economic pressure the coronavirus is placing on China, on the U.S., on all the other economies around the world. Something we have seen is that the numbers are definitely starting to grow in the region. On Friday, when I last checked, there was about 300 cases, and today, towards the end of the day, we're already talking about 600 cases. Local transmission and community contagion is happening in specific countries and specific neighborhoods, and that's certainly something to look out for. And as the reporter had just mentioned, social distancing is clearly an important part of this. Lessons learned from other parts of the world.
Yeah.
Just the discussion we had in France as well, there is that fine line that the government has to walk in terms of implementing stricter policies and making sure that people have the capability and have the possibility to do the things they want to do. It's a fine line to walk on, and I think a lot of lessons from other parts of the world are showing that earlier and stricter measures to prevention is perhaps more economically feasible and more effective in terms of stopping the virus from spreading.
All right, Pepe, I hear what you say about social distancing being very important, but what are we to make of leaders like Jair Bolsonaro, whom, as we just saw in that report, doesn't appear to be taking this outbreak very seriously? He was posing for pictures with people at a demonstration.
I think this specific incident was certainly interesting. The leaders such as Jair Bolsonaro clearly has an intention to instill confidence in his constituents and the people of Brazil. The other thing we have seen from around the world is that panic could be absolutely detrimental, not just for the sentiments, but also for the economies around the world, as we've seen from the latest performance stock markets. But there's a fine line there as well, right? We want to make sure that people are not panicking, but we want to make sure that the leaders are leading by example, and that there's actually lessons learned and best practices that we can implement in all these countries. Social distancing is absolutely one of those.
Right. Paula Regis, I want to get your take on what is happening in Latin America right now. I mean, this, of course, is a huge continent. It's a very diverse continent with different countries having different ways of handling this coronavirus outbreak. But how important is it for these countries to actually to share resources, share knowledge, share technology, basically share expertise in combating the virus?
I think this is actually one of the most important lessons that we'll be taking after all this pandemic situation, which is the importance of sharing knowledge. And as you said, we need to share what is being done. Also, as you mentioned, it's hard to talk about Latin America as a unison. We know how different are the countries, but specifically, we do have a lot of low-mid-income countries in the way our countries are developed. So we need to understand how impactful will be the inequalities in our systems and how hard it is to create also an unison and unique measure to counter everything.
Yeah.
But for sure, like sharing knowledge and sharing, especially capacity building on diagnosis, capacity building on how to deal with media, with social media, with formal media. It's important to mitigate the misinformation which can lead people to a lot of panic, and it's what I can say from here, from Brazil, what we've been seeing. Misinformation can take populations to take bad decisions, and that's why it's so important to have politicians and leaders acting in favor of the public health measures, acting in favor of the whole population.
Yeah. Shweta, there was something we heard at the Monday afternoon news conference that was hosted by President Trump, and that was we heard a timeline. We heard that this could go through until July or August, and the situation, as we heard from Dr. Anthony Fauci, the director of the NIH, was that the situation is reviewed every 15-day segments. But with reference to that timeline, we had a bit of a caveat, a bit of a comment from Dr. Fauci. Let's listen to what he had to say.
When you're dealing with an emerging infectious diseases outbreak, you are always behind where you think you are if you think that today reflects where you really are. That's not word speak. It means if you think you're here, you're really here because you're only getting the results. Therefore, it will always seem that the best way to address it would to be doing something that looks like it might be an overreaction. It isn't an overreaction.
So what do you make of that timeline, July, August? And the other thing is, could you explain what Dr. Fauci was talking about there?
Yes, so if anyone knows what he's talking about, it is this individual. And the guidelines from the CDC, again, are unparalleled. So we should take them very seriously in the United States and then recognize that they work in close association with the World Health Organization. And this is the gold standard, as we understand it, for what we need to be doing to protect our organizations and citizens and public health generally. So What he's referring to is the fact that we need to, at this point, get ahead of the disease. We are reacting because we did not have the information we needed to be ahead of it from the get-go, which was the diagnostic testing. We're flying blind, and we've heard a lot of people say this. Experts in the media are referring to the importance of having this information so we can get ahead of it. And so because we did fly blind for as long as we did, we're playing a bit of a catch-up game. We know that this virus is going to stay with us at least through the end of the year. There's a chance it will persist. There's a chance it will reemerge. All of this is information that will be coming to us as we are able to continue watching how it spreads, watching exactly the way it moves in place through different populations, and as we continue to test and understand the different demographics and populations that are really, truly susceptible to it.
So is he saying there that we need to take the most extreme actions right now, although they may look like overreactions to what's happening, in order that we catch up with this?
So it's interesting because the UK, for example, is saying that they don't want to put in similar types of measures because of fatigue. And ultimately, when these measures will not be right now would be considered an overreaction, but ultimately are needed when this virus is at its peak. And that's when we need people to really be complying. And if they have already been doing social distancing practices for too long, then when it was really necessary, we were going to lose that sort of level of compliance that's really necessary. What Tony Fauci is saying, and I believe that what he's hoping for, is that he gets ahead of that potential fatigue, that we're more proactive, we're putting it in place, and that ultimately we are able to adhere to it over a period of time, and we don't sort of fall off. Because the worst thing would be is if people stop listening to expert advice when we need to be complying the most.
All right, let me go back to Paris to Maria Paula. Maria Paula, the European Union is taking all kinds of steps to combat this. One of the biggest steps it's taking is a proposal to terminate all non-essential travel to the continent, that travel to Europe be restricted. This is what the president of the European Commission had to say. Let's listen.
We think non-essential travel should be reduced right now too, in order to not to spread the virus further, be it within the European Union or by leaving the European Union, but also to avoid non-essential travels, not to have more potential strain on our healthcare system.
So, Maria Paula, how is this what's happening in Europe as far as this is concerned, and how are people responding to it?
Yeah, some analysts are saying that European Schengen network of open internal borders is on the brink of a collapse as more and more countries are shutting their doors in a frantic effort to avoid the coronavirus. President Macron said that if was supposed to close the borders, it should be done in conjunction with all the members. Tomorrow, the 27 leaders from the European Union will have a video conference to talk about these measures. And while the virus is spreading across the continent, we see that these Russian actions taken by Austria, Czech Republic, and other countries, even Germany, highlight an apparent lack of coordinated approach to fighting this disease. But now, finally, it seems that the European Union is working together. As Macron just said at television tonight, non-essential travels will be forbidden inside the 27 countries that are members of the European Union.
Right.
But it's important to say that, Paris, for example, people like to go out, people like to be on the streets and the cafes. And even though the bars, restaurants, cinemas, and nightclubs are closed here, French people were still out on the streets. Prime Minister Edouard Philippe said the government had no choice because too many people were still out on the streets and not applying the announced measure, including keeping a safe distance from each other.
Okay. Pepe, here in the United States, of course, one of the biggest challenges has been the distribution of test kits. But looking at Latin America, I mean, how big a challenge is that going to be on the continent there?
I think this could certainly be a challenge, as we've seen here in the United States. And as Director Fauci has mentioned, where we are right now, where we are today, does not reflect exactly where the situation is. Usually the number is a few steps behind. This is due to the limited availability of testing kits, the limited availability of medical professionals to be able to fully accommodate the potential patients and infected patients, as well as the fact that information lagging is clearly a part of the process as well.
Yeah.
We want to be able to play this cautiously and want to make sure that all the lessons learned from the rest of the world for this matter, that is not a matter to be taken lightly, is get incorporated in the policy-making process, both containment and also mitigation measures in other countries in the region.
Okay. Shweta, very quickly, I've got about a minute left. What about the test kit situation here in the United States?
So it looks as though we've gotten different information, given the day, but it looks as though the testing is picking up and improving. And it is so vital because that's the information that is going to be necessary to ensure that knowledge is power, and the different stakeholders involved in this, from the epidemiologists on the ground to medical staff, to those on the front lines, to scientists, to bioethicists, to economists. This is a risk that involves so many parts of every facet of our society, and information is power. And so we need to understand who is infected, how it's exactly being transmitted. We have some idea based on testing from other countries, but again, it varies so much from country and culture and geography that we need a really good understanding of what is that transmission rate and mortality rate in the United States to ensure public safety.
Right, Shweta, very quickly, in about 20 seconds, if you can, it's one thing to get the test kits. Is there a streamlined, coordinated process to use those test kits?
Well, so now that we are giving permissions to local governments and to private sector to be able to conduct these tests, that lag really was difficult for us in terms of getting a grip on this and getting ahead of the issue. But now that there is more collaboration across other entities, the public and private sector, we're going to see a lot more efficient and effective results coming out from the tests.
And that's where we have to end it for today. Thanks to all of you for being with us. That's all we have time for. I'm Anand Naidu in Washington, D.C. We leave you today with images from Italy, where quarantined people are singing from the balconies to fight loneliness during the lockdown.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.
Hello, everybody. I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week, we take a deep dive on world headlines, talking to experts, journalists, and others. It's a fresh, focused, and intimate look at the issues that matter most. Whether you're at home or on the go, you can find The Heat podcast just about anywhere podcasts are found. Have a listen today and subscribe. Thanks.